So we also, thank you. We also provide leadership and collaborate efforts in mental health as well as substance use disorder prevention to impact primary behavioral health, and also address a lot of the community level problems or risks that we see. So now that we got some good background, let's transition to the Pipp. So the Pipp, this is an exciting tool. And I hope that if there's something, like I mentioned, a creative aspect for this that you could take away from this, it's something where you may be even able to implement it in your community. So the Partners of Prevention portal was created out of the need to better connect Genesee County residents to prevention and wellness programs and services across the county. This portal is intended for both youth and adults, and it was funded from the Prevention Network C3 capacity funds. Shout out to Ruth. She knows exactly what we're talking about and how much of an impact she was on this whole process. So the Partners of Prevention portal is, a really good tool that we've been utilizing in honestly a short period of time to better help connect youth and adults get to prevention programs and services. A little bit of background of where we started. The Pipp was originally developed by the Flint and Genesee group, which is the Opportunity Youth Portal. And this portal was a service provider to service provider portal that other service providers would use to better help serve the students or the youth that they were connecting with. So Opportunity Youth, or RISE, was a youth-led group that helped connect youth with educational and work-related training. And for those that are unfamiliar with Genesee County, there are around 10,000 youth, and that data may be a little bit dated, that are neither employed nor in school. So this youth-led group was designed to help have other youth talk to amongst themselves to come up with ways to help with education, some of the life problems that they may be having. And then that would be utilized in the Flint and Genesee group to be able to help with connecting them to receiving their GED, employment programs, secure employment. Also, if there was any alcohol or drug usage, either with amongst themselves or in the family member, that was the need to help them continue with getting better or helping with providing other additional resources and information. So the Opportunity Youth at Flint and Genesee group is no longer being funded, and this portal was laying a little bit dormant, and there was a few already service providers on it, and they were aware of what they were doing or aware of the portal, but there are some things that we took away from feedback from those that are on it, and we'll get into that in a little bit. But so that's a little bit of background of the Pipp before we ended up taking it over, and it was the Opportunity Youth Portal. And so I think it's good to really address how we got to where we're at in the Pipp. So a portal with new potential. I wanted to put this there because we really had a good idea about, and it was a creative idea. It took some back and forth about really what we wanted to do with it. So we wanted to move, this is a little bit of a detail for background about moving from the Opportunity Youth Portal to the Partners of Prevention portal where it's currently at. So from June to August of 2022, we had contacted the previous service providers on the Opportunity Youth Portal to ask for feedback on the portal and if it was helping with referrals, because it was really intended for people on the providers, the stakeholders, to reach out to other stakeholders to help if it was out of their scope, to connect to other service providers so that the youth can be able to acquire more services readily and easily. So this is where we asked any of the previous service providers on the Opportunity Youth Portal for their feedback. What was the process of getting onto the portal? Did they notice anything in helping with referrals? Did it help them with their marketing aspects? What did it really help with? And if they were aware of it, did they feel like it was, or if there was any improvements that they would like to see? We conducted 3 focus groups from June to August. We had one with previous providers. We had 2 meetings with them. And then we met with 2 external groups or stakeholders that provide youth services. Now, mind you, this was intended for youth services. We wanted to be able to connect. We wanted to expand on not just the educational piece, but encompass all social determinants of health in the community. And we didn't want to also just stop right there at youth services. We wanted to continue it to adults and have all of the things that we can provide in the community, not just as our coalition, but other people in the community, other organizations in the community. We wanted those more readily available. So by August 2022, we finally acquired the hosting rights for that portal. So some of the feedback from the focus groups, we had a lot of the groups say it didn't increase referrals. The employer signed their program and service up and they didn't know they were on it. So the coordinator that we were interviewing had no clue what the portal was about. They just had their employer sign it up for them. And, you know, it makes sense, right? It's an organization signing up their organization. They don't really sign up the coordinator or anything like that. So there's really just small aspects and things like that. There's also a wealth of programs and services designed for youth to thrive, but still they would opt out of utilizing them. And this might be apparent in all communities. If you really think about it, we're all working in silos. In Genesee County, I'm very blessed to be working in Genesee County because there are so many resources and so many opportunities and so many people willing to help. But there is a small aspect of everyone in the community and particularly organizations that are working in silos, working independent of each other. And I think as a coalition, that's where we want to be able to kind of knock down those barriers, knock down those walls, and really try and convene everyone to the table and say, okay, you're doing this a lot better here. You're doing this a lot better there. Let's all work together to be able to make sure that we're effectively reaching everybody. Some of the feedback also included that there was no adequate way to track referrals. It wasn't marketed efficiently, and a lot of external and environmental factors to mitigate to make it easier for people to access. So some of the key points what I wanted to really take away from that was there's so many other external factors, environmental factors that may stop a person from getting to the program or service, whether they don't have housing, transportation, funds, necessary social determinants of health, socioeconomic factors. There's so many key pieces that we want to say, hey, here's a program for a person to want to help them, but there's other things that may deflect them to getting to that or may not be able to do it. We've had coordinators in different organizations say, I will drive to your house. I will pay for it. It's all funded. Everything is all good. And still that may be a no. So it's really kind of taking that concept of meeting people where they're at, giving them time to be able to explore options themselves and be able to feel that they're comfortable to reach out for the programs or the needs or the services when they are ready to do so. And the last key piece was difficulty getting in contact with other providers. Now, this is a key thing that is important to us too, because say whether there's other, for instance, like 211 or Find Help, or if you're calling a hospital system, you're going to get the front desk, or you're going to get answering machine saying, press 1 for this department, press 2 to get to this department, so on and so forth. So there's all those additional barriers. That's wasted time, right? That's time that you're not being able to get back to help someone. If someone's looking for a program or service, or if they're looking for something in their community, you're taking away that time where they feel like they're actively wanting to pursue it. So that is one of the key incidents to it, where we wanted to be able to easily connect people to it. Where is it? So main priorities on our end for the Pipp. Understand your audience, what and how they search for programs and services, and limitations or external factors. Understanding your audience is so key. And I think in public health, we have I'm not going to say a problem, but I think that ultimately there's a lot of keywords and key phrases, and sometimes we forget how to speak to people like they're people. And so really you think about how you search, think about what you do when you're looking for a program or service on the internet. I Google everything. I Google doctor offices around me. I search for housing around me, near my area code, near my zip code. And so you really want to boil it down to that bare minimum. What are some of the things that we wanted to be able to do? And what do you think your audience views, and also accommodate for the limitations or external factors that we previously just discussed in being able to mitigate that and encourage them to be able to seek for programs and services. Incorporating broad categories of programs and services to accommodate the county, reduce accessibility challenges, provide direct contact information, increase referrals between stakeholders, and expand the reach of programs and services countywide. So this is some of the key feedback. This is our way of being able to take the key feedback that we had from our focus groups and be able to create a new portal for the county to use that's marketed, increases referrals, and reduces accessibility, but also resonates with our audience is really what we want to have for it. So priority objectives for the GCPC. Our internal objectives that we want to accomplish as a coalition is to increase our coalition capacity, identify service areas that were gaps in care, convene a networking opportunity for service providers, keep stakeholders engaged, and then enhance outreach via marketing, and then be able to streamline the process from search to referral, as well as increase ease of use for the community. So just very key points and objectives that we wanted to be able to accomplish as a coalition with our internal staff and be able to help broaden our reach, our scope, and enhance our mission and further back our mission and our mission statement, as well as our vision, be able to increase our coalition capacity and reach through various gaps of services that we can be able to mitigate, as well as create more opportunities for service providers and stakeholders to be engaged, as well as attentive to the portal. Now, I will do it in a second. Let's do it in a second. So key features of the Pipp, and this is where we wanted to kind of set the stage for everything. Broad categories, a detailed map to show proximity to program or service. So like I mentioned, if I'm Googling housing near me, I would like to have all the housing programs and assistance programs be able to be detailed and showed how close they are to me. I don't want to go through a step-by-step process of saying, what do I need to do to acquire it? I want brief and easy to read programs or service descriptions. Such an easy thing. Now think about what are some of the forms that I may need to fill out. Well, I want to incorporate all the drop boxes for materials needed. If it's a intake form or application, I want to be able to incorporate those all in one listing. Well, what about the time that I may be able to reach out to them? What are their hours of operation? When can I best contact them? Incorporate that. So, and also, who can I speak to? Do I have to get to the front desk person, or do I get direct contact with the coordinator or the supervisor for that program or service? Also, social media outlets. So I think that's also something too to enhance the marketing aspect of where you can be able to broadcast a little bit more about your program or service. And I guess I should have maybe done this beforehand, which would have probably been a little bit better, but I didn't want to distract and take away from everyone if I just really actively brought this in. So let's detail a little bit about the portal and show you exactly what I'm meaning by it. So on our homepage, and I will drop this also in the chat for everyone, so if they want to see it on their own, explore it some more, if you're a visual or if you're just a click person like myself, and just go ahead and take a peek at it yourself. So this is our Partners in Prevention portal. And this is what I was talking about by saying you want to be able to find everything in the community super easy. And we have 35 categories that are broad enough that reach every aspect of the community, encapsulate all of the programs and services. And we want to be able to showcase them in a broad sense, looking for grief support, Genesee County, housing, Genesee County, newborn supplies, prevention, prescription drug drop boxes, Narcan trainings and distribution, recovery, veteran services, transportation, all of these both protective and risk factor programs and services in the community. Also, you want to be able to detail them on a map, show them exactly where they're at. And so this is the Flint area. So we have a lot of different programs and services all generated on a map. You can be able to easily access them and see exactly where they're at in the community. So we want to be able to make it so easy for people to be able to get anything. And I know Ryan was on earlier. He was talking about his STEP program through Wellness Services. You can search it right there. You can search any program or service that you want. You can explore all the different categories. You can think about all the different ways that you want to look. And if you're like myself, I just explore, click, 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 keep going, check out everything. Hey, I didn't know this was in the community. This is the best way to be able to do it. Some of the other databases of programs services like Find Help or 211, you would have to call and say, I'm looking for this, or you can have to search for a program or service. I think it's best for people to just explore what's out there. I think that it can really be easily to say, hey, look for all the programs and services underneath every category and see exactly what's out there. So I think that's it really helps maximize what the awareness is and the availability for programs and services, but also helps with other stakeholders, because sometimes people just stumble across your program or service while looking for something else. And I think that's important too. So let's continue here. So key features, like I mentioned, broad categories, detailed map, brief and easy to read program or service description. We'll get in a little bit more in a bit here. But also we're looking at hours of operation and so on and so forth. So we'll look a little bit more into that. And this is what I mean by broad categories. And I jumped the gun a little bit to show you what the Pipp looks like, but it's a good way to just really reach your audience by being very broad and thinking about what they're saying. They may not be looking for a specific program or service. You may be thinking about all the different things. So mental health in Genesee County, mental health in 48507 is really what people may be searching more so, as opposed to looking for a particular program or service, especially if they're not aware of it. And so that's where I think it's really important. So some of our internals, so building capacity, increasing cohesiveness. The portal is not going to fill itself. All those beautiful categories and broad categories that you saw, we started with zero. We started with absolutely zero. And we were able to take all of these business cards, all of these little pamphlets, and see all of the community-wide distribution information resources that people provide to the community. We started from ground zero to be able to get some of these in there. And the thing about this is your business card, your flyer, your brochure, it only goes as far as you let it go, especially if it's a paper item. It only goes as far as the social media reach that you have. So thinking about ways to engage people in a more effective manner, more creative manner, to be able to do getting some of those other programs and services out in the community, building awareness for them. And I think that's where, as a coalition, we are really trying to be able to do that, to get more increased awareness to other programs and services across the county. So filling the categories. So we did a lot of outreach, calling and email, networking events. Hey, what is your program? Is it free for youth? Is it free for adults? Give me a little bit of background about it. What does someone have to do to get into it? Would you like to join us for a networking event? So word of mouth, utilize already made countywide resource lists that I showed. I noticed that there's so many different organizations around the county that are providing these countywide distribution resource lists via paper, but I don't know if people actively use them. So there is it's best to be able to utilizing a digital platform to be able to encompass all of these different resource lists. Identify gaps in services or programs that are not included in the portal. So if we see that some of the categories that we are not normally working with, say art or education or physical health, nutrition, some of these categories that we're already not necessarily working in directly, but indirectly work with, hey, you know what, let's incorporate some of those programs and services. We want to expand your reach and be able to work with providing opportunities for everybody to be able to acquire programs and services. And we wanted to provide an opportunity to have varying organizations meet via hosting monthly lunch and learns, because you know what, who doesn't love free lunch? Free lunch gets everyone in the door. And especially if you're coming out of COVID, where everyone's just opting to do virtual, everyone's opting to, you know what, I'm not going to come, I don't want to be able to do a meeting in person. This was the best way to be able to get people to come in, network, show the opportunity about their, showcase a little bit of opportunity about their program or service, and meet other stakeholders in the community. Whether or not they're doing the same thing as your organization, you're aware of that now. You're aware, you put a face to the program and service now. And so it was the easiest way to get people to come is free lunch. If I guess the second point, if you learn anything about this presentation today, it's that people love free lunch. So case in point number 2. Okay, so our lunch and learns, we host monthly lunch and learns to increase the capacity of the portal. And we do this, obviously, like I mentioned, via outreach. So we allow organizations to enter their program or service in the portal by a step-by-step. And I just want to give another shout out to Erin. She's our prevention specialist here on staff, and she couldn't be here today. She is getting her degree, her MPH from OU, but she is the one that coordinates a lot of these lunch and learns, and she does a fantastic job and has made tremendous efforts to be able to do the outreach, the networking, and inviting people to come to these lunch and learns. And so this is, like I mentioned, it's a great opportunity for people to meet, to network, and to discuss their different programs. It really reinforces our mission to act as the central convener for local organizations. So it increases our capacity because now we are being aware of all the programs and services, but they're also entering them in a database that we want to mass distribute to everyone in the community and be able to increase the awareness. But like I also mentioned, it's important because we have a face to the name now. It's so important to be able to put a face to the name, to understand, and then have other organizations from different backgrounds and different populations that they work with to be aware of other organizations now. So a little bit more background about this Lunch and Learn is from September to February, we hosted 5 lunch and learns. And so we missed January because it was canceled due to weather, but we were able to have, looks like 31 different organizations come during this time period. And also we've made the process so easy, and I'll go through that next, that they can do it virtually. They could do it on their own. So we'll go through that right now, actually. So when a member comes to the portal, they'll see want to join the Partners of Prevention portal. So they'll click there and they'll be taken to a registration page. And we did this because this is through trial and error. We are not tech experts. We are not anything of that nature. We are public health somewhat experts, I should say, especially for myself. And we had a drop-down menu here like we have here, and it just got very confusing to be able to do it. And then also bots were being into it. And so we had to go through that, and that's another story to go through. So we added the portal registration here. So this was, you put your name, organization, email, and phone number, and then you would be receiving an email afterwards sent to the provider email address with further instructions. Now, this is also a little bit of trial and error as well. So for a person to be able to, or an organization to put a new partner into the portal, we wanted to detail some key statistics or key things that we wanted to be able to put in there. So first and foremost, the organization and a little bit of description about it. And for someone that's not doing this, or someone that's not at a lunch and learn doing this, we put these little bubbles here. So you can just be name of the organization, description of the organization. And that's all we want to be able to do for the organization. Just be able to put the name, a description of the organization, overarching description, and then a location of where it's at, as well as some phone numbers, and then just general email addresses for it and social media accounts. As you can see, you have a file Dropbox that you can utilize. So like I said, intake forms, application forms, additional resources to be able to put into it. And then the general program name. This is the general program information that we want to be able to include. So like we said, name of the program, and it's different than the organization. So if it's a hospital or healthcare organization and they have a specific program, say like a suicide hotline or something like that, or they have a vending machine for Narcan, this is where we want to detail that information. So this is important and should be different from the organization, because this is where it's going to just be changed from when a user will click through the category to the program. And general program name, program description, and think about your user. Think about what they are, what they're going to be reading. How do you entice them? Keep it short and sweet, bullet points. Don't overdo it. Don't try and sell anybody. Tell them exactly what the program is. Tell them a little bit about the description. Does it cost money? Does it do anything like that? So keep it brief and keep it really engaging. We have a short attention span nowadays, and I'm learning this every day, that we want to be able to keep them engaged at a short and quick period of time. Additional file drops for that program or service, the URL for the program page of the website, and then what categories does it fill in. So select any categories that apply to the program, not what the organization does, just to the program. So that way it's specific in the category list what that actual program or service will be defined as underneath the categories. What is the ages served, hours of operation that you're available. And then this is important. This is the program contact information. This is not taking you to the front desk. This is not going to the organization. This is not going to a help desk. This is the coordinator that is going to be on staff for this program. This is the super important part. You're getting in direct contact with that coordinator or supervisor for that program, someone that you can reach directly and get in contact with them. So this would be their first and last name, email, phone, and then additional social media pieces that they want to be able to showcase. We have YouTube capabilities as well as Vimeo, and that's it. That is so simple. It is easy for an organization to get enlisted into the program or get registered on the program. And so that way we can start to be able to take from there. Let's get back to here. So we created a brief step-by-step how to register on the portal. And this is just kind of lends a little bit about where everyone is at with it. So an organization registers their program or service on the Pipp. We receive and review the registration listing, make sure that the font's okay, nothing crazy is going on. Just kind of, it just gets sent to us as a draft, and then we have to approve it, and then we publish it on the website. We also taken away the capability of people having essentially like a login on the Pipp. So organizations don't have a login. Anything that has to get changed via a program or service, contact information has to go through us. So we approve and publish the listing to the website, and then it will be able to be accessed via the Pipp. And the reason that we have taken away the capability for users to select a password, select a username, things of that nature, is because there is a turnover rate amongst coordinators as well as other staff members. So we don't want people to be that program or service being addressed to a specific person. We want it to kind of be addressed to a specific program or service. And we just want to be able to provide the contact information for that. So now then that's it. It's just people can access it once it's published. And then we increase the access to prevention wellness services. It's increased awareness, and it's increased community capacity and healthier community, and it decreased the prevalence of substance abuse and mental health disorders. Very simple process that we've kind of refined over time to make it super easy for organizations and for other programs to be entered easily. So to date, we have 35 categories. We have 87 programs and services and 60 partners enlisted. So in a span from September to February, that is 6 months, you had 10 partners enlisted for 87 programs and services. And like I mentioned, my second key point, people love free lunch. Okay. So think about doing this all the time. Think about having these many meetings that you may have. You may not be as lucky to get 60 partners, but if you intrigue them with a networking event or a creative way to be able to host a lunch and learn like we did, then you may be able to get more people to join or put their program or service into the portal. And so that's why we utilize that lunch and learn format, is to be able to get more people to join and be able to network with others. So marketing and reporting, and now this is key. Once you have all these programs and services into the portal, how are you effectively going to keep not only your community, but stakeholders engaged and involved into the continuous process afterwards? The last thing we want to be able to do is when a provider posts their program or service into the portal, the last thing we want them to do is just vanish. And that's it. You know, we never hear from you ever again. We don't keep in good contact with you. We want to know that we are maximizing the marketing and the engagement for your program and service. And so this is a key thing too, that where we wanted to evaluate our process and make sure that everyone is involved in this, and that our stakeholders that are on the portal can provide more feedback, as well as being able to market this effectively in the community as well. So we create flyers, note cards, things like that. These are just information and resources regarding the Pipp. So we have this flyer in kind of the size of a note card flyer that we have for this, that we pass out at networking events and things of that nature. We provide this information regarding the Pipp. But I would also like to mention that we field a lot of calls that are not necessarily pertaining to substance abuse and mental health. For example, I fielded a call from one of the local schools that we may not be working directly with, which is a high school here, and they were looking because they called to inquire about housing for one of the students, saying that one of the family members may not have housing or things like that. And I'm like, well, you know, are you on a computer right now? How did you get in contact with us? If you're on our website right now, if you click Pipp, and you can find housing for the community. And they're like, wow, I didn't know this existed. Well, now you do. So it's exactly what we want to be able to do, is to kind of be able to field calls. And even if they're not in our scope or our line of duty, we can now provide them with answers for the Pipp. And then this is the easiest link. We had this for autism service, so we created a category for autism. We had this for housing, so we had to encourage more resources in housing in the community. But we also are now looking at like social media. So we have just incorporated some social media aspects for this, now that we have filled out a good wide variety for our database. And then we want to be able to implement geofencing. So I think I'll touch on that in the future towards the end of this presentation. Geofencing is going to be something that's going to really help with getting this more actively in the community. But it's really about a lot of word of mouth too. So just some simple word of mouth stuff like that we provide between providers or between the community. So that's how we engage with community members. And then this is really how we engage with providers. So engaging with stakeholders on the portal by showcasing our program or service views. So anything that happens in a given month, which categories were actively viewed and searched, where the Pipp is being marketed and how, and then the user digital footprint. So I'll put in the chat. Hold on one second. So we just came out with our first impact report, and I think this is super. This is going to really help with keeping the stakeholders engaged. And if we look at it, it's really a neat way to showcase all of the capabilities of the portal. So we'll walk through it too. I'll pull it up, but so people can have it. But also, I want to be able to showcase it on our end as walk through it together. So, and we'll work through a lot of the statistics. And oh my goodness. So this was for the month of March. We first showcase a monthly snapshot. So the amount of views, the active users for that month, the views per user, and the programs and services. So even from March 31st, when this last month just ended, we've had additional 6 programs and services entered in for this month without a lunch and learn this month, for the record. So we've had additional programs and service being entered, and then we want to be able to break it down even further. What are the categories by user? Mental health categories seem to be the highest for that month. So 43 users went to the mental health category, and these were the programs and services that they accessed. So these are the names of the programs and services that they accessed when they went to mental health first aid, children's behavioral and autism services, life challenge ministries, involves dad, social connection support group, and the mindfulness initiative. Other categories that were utilized throughout that month: abuse, neglect, violence. We want to really showcase all the categories that were there. We want to build this out so much more. It's a little bit more comprehensive, so that we can continue to showcase what programs and services were being accessed by the community. Aside from this social media aspect, we want to continue with geofencing. That will be something that we're doing in this summer. And we have about 50 to 60 locations that we want to be able to utilize across Genesee County to be able to come up with key messages, short videos, ads, anything that can be used via social media or browsing the internet. So that way people can be bringing more awareness to what the Pipp actually is and how to use it. Also, for our stakeholders, we provide them with the flyer for the lunch and learn. So we have the next 3 lunch and learns that's going to be happening for May, June, and August. So if you are a Genesee County resident and you would like to be inquiring about a lunch and learn, please reach out to me and I will be able to get that all set up for us, and I'll pass it along to Aaron. So this is a great way to showcase what people, our impact report really wants to showcase what our marketing strategies are lending to programs and services, but also encourage more stakeholders to have other programs or other organizations reach out to us for furthering continuation of lunch and learns to be able to build out the capacity for the Pipp. So I think that's important to be able to still kind of showcase all the results, but also, hey, continue to help us with this mission of being able to provide effective care and services to everybody. So that is our impact report. I think it's really has come a long way, and I'm very excited to be able to showcase that and be able to provide that back to stakeholders so that they can be engaged. Because that was one of the things that we wanted to be able to do is, like we mentioned in the feedback, not have them lose sight of that this is in the portal and that it's actually actively helping them. And it would be a great way to be able to manage referrals. So a lot of things that we asked too is to be able to see, how does the referrals, are you getting calls or fielding calls regarding the Pipp that brought you to that program or service? So that's where we ultimately want to go to, is to see exactly how effective it is to reaching to those programs and services. Now, reporting analytics, this is a pretty technical. So if I lose you along the way, please don't fret, because I may lose myself along the way as well. So these reporting analytics are detailed information that evaluates the user digital footprint, as well as the influence of marketing strategies. And so we want to use this to be able to highlight the demographics and pages via city, the total portal categories, program and service views. So how many times each of those program, service, the homepage, everything category was viewed. We want to be able to see exactly if they're active users or new user, or active users, new users, what devices they use to access the Pipp, and so on and so forth. So there's a lot of key analytics that we kind of dig through to be able to build the impact report, as well as kind of evaluate our program and see if the Pipp is actually working. Okay. So community analytics, we take the homepage and we are able to utilize the Google Analytics to figure out which city actively used the portal. And it looks like for this time period that I've highlighted, we can see the views per session, the views per user, and the new users. So as you can see, Burton had 62 views. Oh, we go back. 62 views. They used 4 views per session. So visited 4 pages per session, 4 views, and then 15 views per user. So that's very encouraging, very, very encouraging that we want to see that there's active exploring going on and active usage amongst other areas within Genesee County. So we have Holly, Flint, Orion Township, Detroit, Flint Township, Flint, Grand Blanc Township, Flushing, and Grand Rapids. So this is exactly where we want to see. We want to see that there is views going on. There's views per session, and then views per user, and then how many new users are here. So I'll look at, we'll go back to our analytics page that I have here. No, I don't anymore. Okay, anyways. So stakeholder analytics, and this is this is where it may get tricky, and this is where it's kind of fun to kind of decipher everything. So when a user from, say, if we go back from Burton is utilizing it, what views is it? Just this is for the homepage.
Okay.
What views are they actively doing, or what is their digital footprint amongst the rest of the portal? And so this is a very fun way to kind of break it down. So now we have the actual footprint of the portal, of the user, all the users. So there was 68 of the homepage. We could see that some went back to the home, 68 for the portal homepage. They went back to our homepage. But here's the rest, some of the other categories that people viewed: abuse, neglect, substance abuse, clothing, portal, the autism. These are the different categories that people were viewing from the homepage. And then we click into it a little bit further. We dig in to see which actual parenting support programs, the recovery, substance abuse, Prime for Life, legal courts, mental health, disability network. So many different avenues that we're looking to be able to find from a digital footprint. And that's why I think it becomes super exciting. This is, it's exciting, but sometimes could be very hard to decipher, especially if you are not inept, or if you're not, technically inclined like myself, but trying to learn from it. So you just kind of have to be aware of how some people do it. And sometimes it takes some fine tuning about where, how to put people's names or categories or programs or services into the portal, and you can just fine tune it as you go, so that the analytics can match up with what the for March. And this is where it gets awesome, because this is the same data that I pull. They had mental health was the biggest category. So we see mental health first aid, children's behavioral, involved dad, life challenge ministries, social connection support group, the mindfulness initiative, and then some other categories that were taken from, so post-incarceration, substance abuse, suicide prevention, veteran services, and we could just keep digging down even further and further exactly to where they go. So some people looks like they clicked back, they wanted to go to mental health, and they clicked on a different program service. And that's what we really want, is that exploration of various programs and services across the county for a different category and that you see fit. So we see someone went from involved dad, they clicked back to mental health, and they clicked on life challenge ministries to mental health to anger management. It's exactly what we want to have to do. We want people to explore all of the different opportunities and different things across the county amongst all these different various categories, and making it super easy for them to be able to access them. And they're learning and understanding it. And so that's why I think it's super exciting to be able to meet your community, meet what they may be searching for, and meet where they're looking for ultimately. So let me pull this down and I'll show you what a completed, say we'll go to education. So we'll click on a category and you'll get an idea of what a listing looks like for it. So education, you can see the education category, programs that fall under it. And so you'll be able to see a detailed map showing where all the programs and services are at. So you can be able to be like, okay, I live in Davison, which one is closest to me? And it looks like the Boys and Girls Club is the closest, but you also got some additional ones here in Flint, as well as some other surrounding ones. So say I'm in Davison and I want to look for the Boys and Girls Club. Look at it bounce like that. Perfect. It's closest to me. Let's take a peek at what is here. So we'll see the Boys and Girls Club listing. This is the categories that they serve under, education and youth services, the ages that they serve, and their organization. A brief detail about the organization, and then an easy way for the program description. Now, the Boys and Girls Club doesn't have a singular program. They have an organization that details all of these. So serves youths from ages 7 to 17 during an after-school program and summer day camp. The services and activities focus on all of these. So easy to be able to decipher what this program is. It's not a detailed information about every key piece. It's not a sales tactic. It's not anything like that. It just showcase what programs are available, what services and activities are available, the club having 2 different locations, and then some additional videos that they want to be able to do. So a club tour is what they posted there. The program information. So they have hours of operation from 2 to 7. And they have contact information. And so Emily, who works at the Boys and Girls Club, has provided the info one because that connects to her. And then this will be able to take in for their Facebook, their Instagram. So other contact information is available so people can explore it. And then there's their location. So we can go back and check out another one. So like even Job Corps is an education career development. This is their singular program, career development. And so just simple again, program description, offer free high school diploma and GED services, free driver's education instruction, free housing, and free vocational training to eligible young adults aged 16 to 24. Here are the currently offer following trades, all of the trades that are offered. And after a student completes their trade, is to help them with job placement, college enrollment, military enrollment, or help them enroll into advanced training. Super simple, super easy to be read. And this will eventually be able to help them with other future information that they want to be able to do. So they've included a flyer as their file, and they also included a video for a user to be able to see. But this is important as well. The program contact information is Monica Calloway. She is from Job Corps, and she has also provided the hours of operation for Job Corps, and then the contact information for her as well. So her email, and then also the organization's Job Corps, but her phone number as well as the organization's phone number. So this is it. Very simple. Want to be able to encapsulate all the programs and services varying from various categories across Genesee County and be able to put them in a centralized location so that we can continue to keep marketing it efficiently and effectively to the rest of our community. So what's next? Now that we've kind of continued to keep, I think that it's important for us to continue to keep hosting lunch and learns and encourage feedback from stakeholders, because that's part of the time as well. Is that time for our lunch and learns is baked into being able to host a lunch and learn, network, eat lunch, but as well as kind of, hey, after you learned everything today, what would be some feedback, or what would be some things that maybe you would like to see on the portal? And so continue to encourage feedback and getting from both the community and the stakeholders that are involved with the Pipp. Like I have mentioned, we are going to start with geofencing awareness ads to key locations across Genesee County. And then we want to use the C3 continuation funds. Hopefully, I think actually we have. So to contract our marketing specialist that's going to help with the geofencing and the social media aspect with it. But also, it's really important for us to take the next step and host youth focus groups to better serve the youth population. What would they want to see, and how would they want to access it? And so some of those key focus group questions that we want to have are going to be able to help us better serve that particular community going forward. And, you know, just on my end, just get better on the analytics. I think that's going to better serve our stakeholders, keep them more engaged, keep them more involved, and then hopefully build tremendous steam going into the rest of this year, as well as next year, and furthering that in the future to be able to build on it and encapsulate more programs and services. So I know I spoke a lot. I'm getting close to an hour. Is there any questions that anyone may have? I actually have it going to the chat.
What questions do people have? I've got a question. So people kind of they register their program, and then you must probably vet it on your end. Or have you had any issues where people outside your area are trying to register their program that maybe doesn't fit, or maybe doesn't even pertain to Genesee County, or how does that work?
So we've had, let me go back. So I will actually show one of the key ones that we've had is, I believe, Sanford. Let me go back to the Pipp. So we want them to also, if there's a state organization that is providing for Genesee County as well, that is something we want to be able to incorporate. We want to be able to have all the resources available. So even Sanford right here is behavioral health. That's an eating disorder treatment. And they came all the way from Marnie, Michigan to our Lunch and Learn to be able to put their health eating disorder treatment, because it's apparent to Genesee County. They have programs and services that help that population. And it was something that we as a coalition were not having, that was a gap in our care. We were not being able to address eating disorders in Genesee County. So Sanford Sanford Behavioral Health does a tremendous job with being able to have all the resources and information available, as well as programs and services that suit the needs of all the users. So even if it is not apparent to Genesee County, they are able to be registered on the Pipp.
Questions for Anthony? Looks like a great tool. Lots of positive comments. I appreciate your enthusiasm. Work so hard. Amazing resource. Paige.
Awesome.
Is there any liability issues?
I don't want to say no, but not that I'm aware of, because we're actively having the program in the coordinator or the supervisor for that program enter it in themselves. And so it seems like if there's anything that they need to put on behalf of the organization, they get it checked with their staff members that oversees it. So if it is an HR department that needs to overlook it beforehand, then they get the okay to post it, but it's all on them. They post all of this information, and this is just a resource, virtual resource database for those in Genesee County to find programs and services.
Thanks, Paige. Other questions?
One in the chat says, how do you fund the Lunch and Learns?
So we have, from various grants that we've used, some from the C3, not apparently, but also DFC and other grants that we have, block grant funds and things like that.
Well, last question. It's kind of a big question. How would I start something like this for our county or coalitions?
So great, Monica. This is simple. I'm not going to say simple because it took a long time to get all this done. This is just a WordPress platform. And there is, it was kind of simple for us to just add in categories, programs, services, and things like that. If you had someone that is tech savvy enough to be able to get all this situated, I can help. We can maybe help with the coding and stuff like that, or be able to get that to them. But it just depends your website format. Ours is WordPress. So it was very easy to just add categories, program services, and be able to have it all put together. But really, it would be, I just would love to see a lot of other communities be able to put this together themselves and find opportunities to do something like this to better enhance their reach for all programs and services. Yeah. Monica, I am not tech savvy myself. I'm still learning.
I think you may have alluded to this, Anthony, a little bit, but what is the process when there's staff turnover?
So Lisa, good question. That's why I think it's important. I mentioned like when someone puts in their portal registration, we used to have them have a username and password. And so this is where it's important for us to not have them create a username and password. For one, if a staff does turn over, there is that password and organization and that partner listing is lost with that password. I don't know if I could see it on my behalf, but all we have to do is when there is a partner or if there is a new staff, we have to make that change. And that's simple. That's just changing the new contact information for that partner or for that person in charge of it. Okay, stop sharing.
All right, thank you so much, Anthony. The Pipp sounds like it's going to be it is a very useful tool, and thank you again for sharing that. So everyone, we are coming to actually our final session of today, and before Lauren and Nicole introduce themselves, I would just like to introduce Dr. Grenade Dudley. Dr. Dudley has not only been a professional advocate of children's welfare for more than 20 years, but she's also the president and chief executive officer of the Youth Connection. As a licensed clinical psychologist, she's well-versed in the issues related to youth surrounding after-school programs, such as the reduction of youth violence, substance use prevention, and career development. And at the Children's Center of Wayne County, she designed a specialized foster care program, which actually won the Innovative Foster Care Program of the Year award from the Michigan Federation of Private Child and Family Agencies, and her abstinence program received the Governor's Community Service Award. So welcome, Dr. Dudley, and thank you so much for being here today.
And do you want to introduce yourselves? I don't know who's going first, Nicole or Lauren or Dr. Dudley, but
I think Lauren and I were planning on going first. So let's see, I'm going to share my screen.
So while Nicole is doing that, I can introduce myself really quickly. So my name is Lauren Reed, and I coordinate the Grand Traverse County Drug-Free Coalition, and I am also a prevention specialist with Up North Prevention through Catholic Human Services. And Nicole will pull up our presentation, and then she can introduce herself as well.
All right, sorry, I was just having some issues with dragging that over. So my name is Nicole Flickham. I'm project coordinator for SAFE in Northern Michigan and a community health coordinator at the Health Department of Northwest Michigan. And so Lauren and I wanted to show you guys a project that we coordinated with the Drug-Free Northern Michigan Coalition Alliance to do. So, and I'm presenting on this for, SAFE and the health department, but also my coworkers, Amy and Ellen, did the majority of the work on this project. And so I'm presenting on it today, but not taking full ownership for it, obviously. They did a lot of hard work on this project. So this is the Youth Speak project, a vaping prevention photo voice project by the Drug-Free Northern Michigan Coalition Alliance. And what the Drug-Free Northern Michigan Coalition Alliance is it's 21 county coalition alliance that's for the northern lower 21 counties of Michigan.
So first, I will just describe a little bit what photo voice is for those that aren't familiar. So it's a visual research methodology. So it allows the participants to use photographs to document, reflect upon, and communicate issues or concerns. So the purpose is to create community change. So it was actually developed in the 1990s, and one of the creators was actually from Michigan. So she was from the University of Michigan.
So when we started this project, the first thing we wanted to do was establish the focus and framing questions. So the framing questions really identify whose story do you want to tell? And we'll go into more detail on all of these bullets in our future slides. But we also wanted to establish a timeline and our participation guidelines, creating the youth authorship and the release form and submission process, the youth recruitment process and completion of their story, and then compiling the submissions and deciding how to share them. So this is really just an overview of the process that we took to complete this project.
So taking a deep dive into each of those steps that Nicole just talked about. So first, we started thinking about what our project was going to focus on and the framing questions. So if you were to do a project like this yourself, you'd first want to ask yourself, what will your photo voice project focus on? So you can define the focus of your photo voice project. For ours, we focused on youth vaping and their concerns and perspectives and experiences surrounding that. And then once you have your project focused, then you can start thinking about what your framing questions will be. So these are the questions that you can ask your youth, or if your project's not targeted youth, you can ask your participants. So they're going to reflect upon that and then take the pictures and write the stories based on these framing questions. So when establishing your framing questions, you want to ask yourself, what story do you want to tell? For our project, we had 3 different questions that we gave to the youth. So it was, what influences youth to start vaping? What keeps youth from vaping? And how does youth vaping impact your community? And when you are developing how you want your project to look in the framing questions, you can decide how many photos you want from each participant. So we presented the 3 framing questions and we allowed the youth to answer any or all of them, but we asked that they answered at least one of them.
Okay, so when we were establishing our timeline, we wanted to be sure that we took into consideration like the youth schedules, what they had going on with, you know, athletics or with, you know, just holidays and school closing, spring break, all of that. And so we also wanted to be clear in our timeline about defining specific tasks with dates. So we knew like from October 1st to November 30th, we wanted to do youth recruitment. And then you guys can see further on down the timeline where the other tasks fell within our timeline. So I felt like this timeline from October to like, we completed this project from October to April 1st. We're in the process of sharing it now with our communities. But from October 1st to April 1st is really the time it took for us to recruit the youth, get them to submit their stories, as well as compiling it. So we also had to establish some guidelines of who was going to participate. So we decided you know, that we wanted it to be high school age youth who live in or attend school in one of the Northern Michigan regional entity 21 counties. So, you know, when you're thinking about doing a photo voice project, it's like whose story you want to tell. Yeah, I'm not sure. Sorry, I'm just looking at the chat. I'm not sure why you guys can't hear me that well. I don't think it's related to the headphones, but maybe, I don't know. I'm not sure. Is that helpful?
I
can
don't
you
hear
okay.
a problem.
What's
Nicole.
I don't either.
I don't hear a problem.
Okay, Lisa, you don't hear a problem. Okay.
Yeah, it's fine on my end.
Okay, cool. Okay, so then we create, this is the youth authorship release form. So what that, oh, sorry, Lauren.
That's okay.
Okay.
I wanted to go back on something that Ellen put in the chat about framing questions. So she brought up a good point. So we presented the 3 framing questions, but you would answer each framing question with a different photo. So you wouldn't really be able to answer all 3 of those questions in one photo. So you would have multiple photos if you were doing multiple framing questions. So moving on to this, so you'll want to create a youth authorship release form and submission process. So on the left there, you'll see this is just an example of what our form looked like. And when you're creating your own, you're going to want to consider how you want the names to be listed for authors. So for example, you'll want to find out if the youth want their names printed with their photos and stories, and if they do, how they want it to be written. So if it would be just their first name, if it would be their first name, last initial, or their full name. And then also finding out if they give you permission to edit their quotes for spelling and grammar. So we would never edit the context of their stories, but this is just saying that if we were reading through it and we saw some grammatical errors that needed some fixing, that if they gave us permission to do so, we could make those edits. And then how do you want your authorship and releases and photos with your stories to be submitted? So when we were working on our project, we were trying to consider how we wanted to compile all of this information. So for us, it worked to have a central location. So we created an email address that was just for this project. So the email address was given to the participants, so they were able to send all of their forms and their photos and their stories to this email address so that we were able to have it all saved in one place.
All right, and Lauren, you can see my screen okay, right, with the PowerPoint?
Yes.
Okay, cool. All right, so then this is the youth recruitment and youth completion of photo with the story. So we just kind of put, so you guys, we put samples of like the stuff that we used on here because we really wanted you guys, like, if you want to do this, to have the tools to be able to do it. So this is the photo and story reflection worksheet. And so this was what we used to help them brainstorm and get thinking like, okay, what is the story that I want to share? Like, what does this photo portray? Why is this important to me? And what does this photo tell others about my community? So we included this reflection worksheet in a packet for the Youth Speak project. This was just one of the items we included. We also had the authorship form, the project description, the safety and ethical guidelines, samples, due dates, all of those things. And then we actually created an email address for this specific project. Okay, so we were going to show you guys the actual final product that we did. And oh yeah, Susan or Ellen is saying if you'd like to have the actual forms to email her. But I'm also going to share, I think I forgot to share my audio.
While Nicole's getting that ready, I can just give a little overview. So we did this, like Nicole had mentioned, throughout our 21 county region. So we had 23 total submissions across the region, and we had 11 different counties represented. So that meant that we had some youth from the same county or from the same counties represent or submit multiple, which was great. And then when we were deciding how we were going to share this data, so our first presentation was last Friday, and we invited the youth to come and speak at our Northern Michigan Regional Entity quarterly meeting. Unfortunately, it was during the school day and we weren't able to get any youth there in person. So then we still wanted their voices to be heard. So the students that participated then created a voice recording so that we could share their photos and we could still hear their voice while they were telling their story. So that's what we're going to share with you today.
Isabel, hang on just a second. Now I'm having issues. Okay.
Isabel, it's just a vape. Don't worry, I'll be fine. It's not like I do it all the time. These are all words spoken from our teenagers today, from overheard to spoken directly towards. These should not be the norms of our time. All of these lies are put into our heads, making youths grow up to believe vaping helps with stress, when in reality it's all fake. It's all artificial. Vaping is not a way to cope with our life or to cope with your internal voice. Vaping doesn't save your feelings or yourself. Vaping needs to stop being so easy to get, so easy to buy, and so easy to hide. Vaping needs to stop.
Yup. Believe it or not, there's a secondhand pollution for vaping. Say someone is vaping nearby. You think you're just gonna get some sweets or whatever, but it's just a vape. Just like the toxins released from the fire in this photo. Dang. I wish we could live without vapes, but here we are. People exhale their smoke, their breath, their toxins into the air, which allow other people to smell that. And that's gross. Not cool, guys. Really.
When you vape, you lose your friends, family, and you lose yourself. Vaping addiction can cause you to stop thinking. The only thing that will come to your mind is, where's my vape, or when can I take another hit? Vaping will make you go crazy. The worse it gets, the more things you'll stop doing. Vaping addictions can lead to mental illnesses, decreased hygiene, and you can also stop caring about school. When your mind is so focused on the addiction, your grades will begin to drop. You can stop caring about hygiene. A lot of the time, if you keep the addiction, it can almost be impossible to get rid of when you're an adult. Teenagers can get vapes very easily from parents, siblings, and friends at school. Vaping is a trend that needs to stop. Most teenagers start vaping because they think it's cool, and also their other friends are doing it. When the trend starts to gain more and more people of younger ages, that's where the problem begins. When teenagers see their celebrity idols vaping, they'll start to do it too. Vaping is something that we need to stop.
I don't vape because I want to be able to do sports like running. I want to stay healthy, and vaping would negatively impact sports and my life. I know vaping would make me struggle with breathing, and that would slow me down when I run.
Peer pressure influences youth to vape. It is easy to assume that this pressure only comes from friends, but it can also come from family members. Parents encourage their kids to vape because it's safer than cigarettes, they say, or you need to calm down and take a hit from my vape. It is not unusual for a parent or older siblings to legally purchase a vape for their kid, and then this kid sells a vape to other kids.
When teens look at a vape, they see an escape that is dangerous, not just physically, but mentally too. But it's addictive, and they can't stop. But when they finally look into the mirror, they will realize that they can get through life without nicotine. And that is where the real change will begin.
It's hard to say no when so many youth are vaping. Vaping is a huge thing in my school. I estimate that 8 out of 10 youth vape. At school or other community events, everywhere you look, there are people vaping. It seems like a completely normal thing to do.
This photo shows where I find teens vaping in my own school and community. It affects everyone surrounding them, not only your own body. It affects how you act, feel, focus, and so much more. I would love to spread awareness to my small community about where teens and why teens are vaping. My community needs to know so they can help break the habits in the teens. We also need to get back to having a small, safe, healthy school again.
Kids love crayons. Their colors are attractive, the names of the colors are fun to explore. Vaping is the same. Youth are attracted to the fun of experimenting and trying out the cool flavors. My friends and I enjoyed trying out all the different flavors. Did you know that vapes come in blueberry, apple, cotton candy, and spearmint, and many more? Those names seem pretty harmless, but before you know it, you are addicted to vaping.
The first question I was asked when I shared this photo is, where did you find all those vapes? It was easy. I took a short walk around my neighborhood and empty vapes are easy to find laying on the ground. Littering is also an issue with vapes, but I want to talk about all the reasons I listed for not vaping. I used to vape. It was hard to say no to my friends. I liked the buzz it gave me the first time I vaped. Each time I kept doing more and more trying to get that buzz. When that didn't work anymore, I moved on to marijuana. It was hard to quit. I was addicted. Now when I think about vaping, I think about all these bad things and how I need to be smart about my own health.
Hello, it's Avery Houston, and I'm going to talk today about what influences youth to start vaping. Youth have a lot of stress and pressure in their day-to-day lives. Unlike adults, youth don't have the experience and/or knowledge of how to deal with stress and pressures. A few stresses and pressures of youth are extracurricular activities, social pressures, school, and family and friends. Our lives are filled with daily activities such as schoolwork, sports, clubs, and all of the fun things that youth do. Even though these might sound fun or a way to relieve stress, there's actually a lot of pressure that comes with them. Pressures of seeing everyone else vape and wanting to try, or seeing their family and friends vaping and wanting to try. Youth relieve their stress by vaping because it relaxes their bodies to calm their mind, not to focus on the stress. The pressure of not vaping and or vaping can be very high, especially when it's by their peers. Thank you.
Whoa, is that a vape? Cool. It must help my depression and anxiety at least a little bit, right? Well, it did for a few minutes of high from the serotonin of, oh, that was cool. But in all reality, it made things worse. Vaping only caused more of the sads. At first it seemed like a good drug, but it turns out it's dragging me down more than before. I was addicted to the short high, but then my anxiety got worse because I couldn't get my hands on it. Or, if I had a vape on me, I was so nervous about getting caught, I would go crazy thinking it was the end of the world.
Okay, so that just highlighted about 12 of the submissions. There was actually but sorry, like Lauren said, around 22 submissions. So we have a booklet with all of those, and I can drop that booklet into the chat. So if anyone would like to review them and be able to read them or share it, then you're welcome to do that. Okay, so I know we have a few more minutes. We're splitting the time with Dr. Dudley. So we're going to go, Lauren and I are going about until 3:20. And so if anyone has any questions about Photo Voice, we're happy to take those now. Or if there's no questions, then I have a couple other videos to share with you guys that Safe in Northern Michigan completed for our media project. So
Ellen has her hand up.
Oh yeah, Ellen, go ahead.
Hey, I know you had asked me if I would present originally, and I was like, no, I don't want to talk about the Photo Voice anymore. But I think I just want to say that this was the first time that I was part of a Photo Voice project. I didn't know anything about it going into it. We had how big was our subcommittee? I don't know, probably 6 people. Was there 6 of us, you think?
That sounds right, yeah.
And I just would recommend it to any group that can pull it off. I feel like we learned so much. And this project was just presented at a 21 County Alliance meeting last Friday. And we had representatives there, or aides of representatives there, to see what was going on. So it was just a really great way to get in contact with our local legislators. And we were trying to figure out how to present it in a meaningful way, and having the youth record their voices. That was something that the committee decided, I don't know, maybe 3 weeks before it was ended up being presented. So it definitely was we had to pivot and turn and change our minds, and it was messy, but then it just really came together well. And I appreciate you, Lauren and Nicole, for being willing to share this with this group.
Yeah, thank you, Ellen, for adding that. I'm really excited about it also, and I think it turned out great. And we do plan on, using some of the language in there to make a media campaign. And so I think we're just going to continue to use this information and share it with our community, because it's very powerful coming from the youth population.
All right, one of the questions in the chat is, were any of the kids former vape users?
Yes, I think that a couple of them. So when I drop the booklet into the chat, then you guys can read the stories. Sometimes it's easier to read them than listen to them. It just depends on personal preference. But a few of them do mention being former vape users.
We didn't make them disclose that, but like Nicole was saying, some of them put it into their stories. So we found out that way.
Okay.
And that's another thing, I guess, when you guys look in more detail, like on our slides and stuff, you can see, like, with the authorship form, we did make it, we did ask the youth to identify, like, how they wanted their name to be, if they wanted to be anonymous. We chose not to include any last names, but in our booklet, there are like if the youth wanted to, then we did include their county as well as their first name.
Okay. Any other questions? If so, raise your hands, please, so you can be recognized. Any other questions for Nicole and Lauren?
Oh, I see one.
You see it? Right, okay.
Yeah, do you visit other school districts? So I personally, well, I guess this Photo Voice project was for represented. Okay, Ellen, you might have to jump in here. I believe it was, oh, I wrote it down actually, 11 different counties. So we invited all 21 counties to participate, but we got submissions from 11 counties. And so I'm not sure,
Yeah, this went out to a handful of school districts. So then the partners in prevention from the 21 County Alliance are free to share this. It is for the Drug Free Northern Michigan Alliance. Another thing that's cool, and I'm sorry if you touched on this and I'm repeating what you said, but we are pulling a media campaign out of the Photo Voice. And although 11 counties participated, all the media campaign is going to be shown across all 21 counties. So, and we will take off, in the media campaign, it won't say which counties the submissions came from, because we wanted to be inclusive of all of our counties that are still trying to engage better with youth. And yeah, I don't know if that answers your question. The amount of school districts that are covered is so many because it's covering 21 counties. I actually don't know how many school districts we cover. We should find that out sometime. That's a
lot.
That would be a cool thing to know.
Any other questions?
Okay, so I did just.
Harry has his hand up. Harry Bonner?
Yes, this is a fascinating project. There ain't many projects that youth are interested in, but this one, definitely I know that our young people in Calhoun County would be interested in learning more about this. And that's my question, do you visit other counties? And we're not are you guys only in the northern Michigan counties, or are you?
Yeah, we're northern lower Michigan is our PIHP region.
Okay, so I think, did you mean, are you asking like if we would like present to
Yes.
your group? Yeah, I mean, I feel like we would, someone could at least talk to you guys about it, or you could just take this Photo Voice booklet. I think, Mike, I think, is sending out all of the presentations. So I know like you'll have a copy of our presentation, and you also will have the Youth Speak Photo Voice booklet. And so you'll have essentially everything that we just talked about. But yeah, I mean, I think reaching out to Ellen or Lauren or I would be completely fine if you wanted more information.
I definitely would. I'd like to invite you guys to. School year is almost out, especially for a lot of our young people at our school district, but to come south. It's warmer now. It's not as cold. So anyway, would like to talk to somebody later. So I would be giving somebody a call. Thank you.
Thank you.
There is some information in the chat as well that's been dropped in there. So please utilize that information. Any other questions right now? Okay.
So if we do have another, I don't know, like minute, I was going to share
our
3 minutes. Okay. This will only take our other PSAs if anyone was interested in seeing them, because it's another youth project that Safe in Northern Michigan participated in. Well, this was just for our media campaign. So this isn't the 21 county, but we just thought it'd be cool if you guys wanted to see it.
We are the 84% of youth in the safe region who don't use alcohol.
Brought to you by Safe in Northern Michigan.
Survey data provided by My5 2022.
We are the 83% of youth in the safe region who don't use weed.
Brought to you by Safe in Northern Michigan.
Survey data MyFi 2022.
Okay, so that those are our PSAs, and I did see one more question that said, did you say that you had a trainer come in before the youth started? So this is really, really cool what we had, because Amy Horseman, my coworker that I mentioned, had already led a photo voice project. And so she helped to create a packet that we all then took to our youth and trained them individually. So it was like Amy trained us, then we trained the youth. And so that was really helpful. And so yeah, but we definitely talked to the youth about the safety and ethical abortions, and briefed them on what we were looking for, so that we got quality responses, if that makes sense. Yeah. Okay, so I think we'll turn it over to Dr. Dudley. So.
You are on mute, Dr. Dudley.
And unmute myself. And this is what I want to share. And hopefully that's the one that came up. Can you see that? Mike, again, really thank you for inviting me to be part of this. And we go way back. I remember years ago, I don't even want to admit to how many years, but one of the things that it's been fascinating, Lauren and I have been talking by phone or emailing at 3 a.m. and all of that good stuff. And the thing that I find fascinating is that some of the things that I'm going to talk about are similar to what they are talking about or what they have already shared with some of the projects that we're doing here at the Youth Connection. My name again is Dr. Grenade Dudley, and I am the president and CEO of the Youth Connection, and we're located in Detroit, on the east side of Detroit. And I'm also the chair of the Love Detroit Prevention Coalition. And I entitled this presentation, Hear My Voice. And one of the ways in which we try to engage youth is to make sure that we understand what they're talking about. All of us may have grants that dictate some of the things that we must do. It'll tell us all the outcomes that we're supposed to have, and then things that they expect to see. One of the things that we do is that the strategic prevention framework, when we engage our youth, we teach them about the strategic prevention framework, how they can assess their own communities, look at capacities, plan activities themselves, and to get engaged. The other thing that we have used that also helps, one, to engage our youth, but also to look at the things that result from the programming and the projects that they engage in, is because National Coalition Institute, there's 7 strategies for creating effective community change. We've all heard the story, of the pond where, we're going in and there's this frog that's sitting in the pond. We take the frog out, we clean him up, make sure he gets all the resources that he needs, and then we put him back into the polluted pond. And so part of what we try to do is, how do we clean the pond? What are some of the strategies that we can use to make sure that we impact our greater communities, et cetera? And so some of that has to do with looking at policy. Some of that has to do with how do we create opportunities for change in the communities that our kids are living in. One thing is learn the lessons that they give us. We can go in and decide that this is what's needed to clean up the pond, but we don't listen to the frogs, or we don't listen to the kids that are in the pond. And we had to learn this lesson painfully, very expensively and very painfully, because sometimes we come in with our expectations from our funders and they tell us what it is that they need to see. And then we say, okay, we're going to go out and we think this is an awesome idea and these kids are just going to love it. And then when the kids push back or don't participate or don't show up, we wonder there's something wrong with the kids. All right, so one of the things that we learned from our kids is not about me without me. How do we get kids engaged to participate in the projects? And I think the presentation that you just heard, it was engaging. It talked about one of the challenges that they see happening in their own communities. And so, I mean, we've spent a whole lot of money for, engagement campaigns. And one big project we had, it had a big circle with an X through it and just say no, trying to tell kids, this is what you're doing and this is what you're doing wrong. And we're going to come in here and fix it. And our kids, their response to us was, primarily, why is it all the time that we have to see the big circle and the bullseye with the X through it? What is it that you want us to do? And let's talk about how we feel that we can make that happen. And so we did several things. One, they insisted that we needed to hear their voice. So of course they designed this logo and it's on their shirts, to hear my voice. And so some of the impactful youth projects that we have, the media campaigns that they help to develop and act in and script, participation in various trainings, presenting at national conferences, encouraging the kids and taking the kids. They've gone to, I think they've presented at 4 CACA presentations. So they're presenting to a national and sometimes in some instances, an international crowd. We also did photo voice, but we also added environmental scans to some of the projects that the kids wanted to do. And they identified, who, what, when, and where they wanted to do it. And then we had compliance checks and the impact of what it is that they saw. We wanted to make sure that if the kids were doing these projects, how is it that they're going to, 1, express their concerns, and 2, that we hear their voice. So in the media campaigns that we did a couple. In our community, there's a lot of billboards, and oh my God, even more billboards sprouting up now with the approval of marijuana, et cetera. And where are they? They are targeting in the communities of the underserved, the underprivileged, not in communities, in affluent communities. He said, no, not on our watch, not here. And so around our schools, all of those kinds of things. And so part of it is that our kids are saying that there are other things that we may need to do. So we did one where if the kids submitted proposals for a billboard campaign. If that billboard campaign was selected, the billboard was placed near their homes with their names on it. And so this was something that they got really excited about. And one of them is that in the circle there, if your name's not on the bottle, they're not meant for you to swallow. And that was our campaign about the, non-medical use of prescription drugs or any drug. And so part of it, and they began to talk about what that was. And we made the assumption that our kids were, taking granny's drugs or taking mom's drugs and things like that. And one of the things they pushed back and says, Dr. D, my mom is selling her drugs. All right, so one of the things that we began to learn are some of the disparities, some of the challenges that are happening in our communities, and that the kids, their front row seats at the ACEs, the trauma, and all the other kinds of things that may be impacting their community. I like the kinds of things that we sort of overlapped in. They did social media, and we also geofenced. And we geofenced around liquor stores, meaning that if a kid was in the parking lot or inside or on the sidewalk in front of a liquor store in our community, because we listed them all out, they would get a prevention message that was sent to their phone. Their phones are always on. If you go past the McDonald's and all of a sudden you get an ad on your phone saying, hey, Big Mac's 2 for $10. And part of it, we just use the same technology that companies out there are using. These 2 ads here were part of the social media streaming that happened. Nearly half of all Detroit high school students have never had a drink of alcohol in their entire lives. And this was taken from the YRBS survey. And the other thing was our kids wanted to not always see something depressing, the ads that, we want to get the message across, but what else can we also share at the same time? And this was a picture of a young person graduating from school, but not if you're drinking alcohol. So one of the things that we did when we created any of the campaigns, and if we had our social media expert create the campaigns, they were filtered through our kids. And in some instances, the kid says, we hate the music. You know, and it's like, okay, they didn't like the music. They didn't like how depressed the music was. And we went back to the drawing board to say, okay, these were the responses from our kids with regard to that campaign that's about to go out, and we need to change it based on the input that we got from them. One of the other, you know, everybody, Saturday was our DEA take back across the state, across the country with the DEA. And that part of, remember when we were in COVID, we couldn't collect the pills. And I think they shut it down for either the April or October, one of the DEA take back times. And so our kids had been very interested in looking at the take back and doing something. And then we filtered it by the DEA, and we wanted to run this in our social media campaign and on our website. And this was one of the videos that the kids put together.
What's up, y'all? Hey! Alright, so what y'all got?
Man, I got my uncle heart attack.
I got my grandma's.
Oh, okay.
You know, her legs not in pills.
I got my runner pills right here.
Runner pills?
Yeah, they feel like the athletes, when they get hurt, they take pills.
Alright, well, it's time to mix them up.
So the question is, who going first?
Not me. Not me either. I feel like the host should do it.
Yeah, come on.
Yes, sir.
I don't know.
Come on, man. That's your
Come
part.
on,
You
man.
gotta
Come
go
on,
first.
try to
You
do
get
it.
first. Let's go.
Okay, bet.
Yeah. What's wrong?
Yo.
Giselle.
Oh my goodness. Giselle. He's not moving. Oh my God.
Giselle.
He's not moving.
9.9 million Americans misuse prescription drugs.
Most misused prescription drugs are taken from family members and our own medicine cabinets.
Participate in the DEA Take Back.
And that was, you know, we were really excited about the kids wanting to do this. And we were able to run that back, I guess, in 2021 when we didn't have the take back. And the DEA did support that campaign. And so it was a way in which they could participate. It's a way in which they talked about, you know, where they could get access to medication. And the other thing that we saw was the peer pressure, you know, come on, you could do it kind of thing. And those are some of the things that the kids were experiencing. One of the other things that we talked about with regard to enhancing skills, participating in trainings and training the kids on a lot of the things that we need them to do to be part and to be engaged. We do Narcan training, and as many of you do. And as you know, the DEA says we can train folks as young as 14 and up. You know, anybody that wants to come is 14 and over. We can train them under 14, but we can't give them the naloxone. And so, you know, with our health department, with the state, we have access to the naloxone, and we provide that for all of our kids that we go through the training. We also partner, you know, we look for those intact group of kids that we could work with, and that we work with the Detroit Police Explorers. And we went in and we did a training for the Detroit Police Explorers. The outcome of that training is one of the young ladies that participated in that training was instrumental in saving the lives of 2 people. She went through the training, she went home, she was ecstatic. She told her mom and dad about what she had done. And then while she was in school one day, her mom called her and said, you remember that time you told me about the Narcan training? This is only a couple of days after the training. You need to walk me through what to do because somebody has just overdosed in our yard. The mom went out, she was on the phone, she walked her mother through what to do. And of course, you got to call 911. And so literally 911 told the mom that, you know, her daughter walking her through that saved her life. This didn't happen once, but it happened twice. Now recognize she's an explorer. She's part of the Detroit Police Department. And the result of 2 people overdosing in a space of less than 30 days in front of this woman's house said, in this neighborhood somewhere, there's a trap house. And they were able to then use the information that they had gotten, the input from the parent, the input from our young lady, and to go and close down that trap house that was in that neighborhood. So part of the things that we're looking at are what are the challenges our kids are going through, what are in the communities that they're living, how do we then equip them to sort of deal with those challenges, et cetera. And her excitement was just absolutely phenomenal. She was recognized. We were supposed to be on national news, and then the war broke out, and so we sort of got displaced. But the fact that she was recognized by city council and other places, et cetera. We also teach our kids first aid and CPR and all the kinds of things that now they are equipped. And that was one of those, core strategies for community change that we engage in. So we looked at the photo voice project that we had. The kids also did what were called environmental scans. They also went and identified risk and protective factors in their own communities. And then they also did what was called 1,000 Feet from Me project, cataloging the debris around their school, within 1,000 feet of their school. And it was so cool because we bought them this thing that you can roll out and you know where you're exactly 1,000 feet. And they took pictures of what they found around their schools that were there. This was presenting the risk and protective factors. And, if you could just put in the chat, and Lisa or Laura, if you could look at this for me really quickly, if you could just put in the chat, the first picture is of a school. What would you define that as a risk or a protective factor? You got to roll it in the chat. All right, is a school, or, the school, would our kids define school as a risk or protective factor? What do you see? Okay, I gotta look. No, I can't.
We're seeing some protective. It could be either, hopefully protective.
All right. The other one is a bar. Now, this is for the kids that were in our community. What would you consider the bar to be, risk or protective?
All risk for this one.
Okay. The gas station. This is sort of a janked up gas station, but just, a gas station. In your chat, what would you see is a gas station a risk or protective factor?
Mostly risk. I see one both and one depends.
It's either or. You can't Who said that? All right. When we asked our kids, and that was one of the things, because we make assumptions that these things are supposed to be risk, protective factors, and this is definitely a risk factor. The school was considered, in the community that these kids are in, the school was considered both a risk and a protective factor, but mostly a risk factor. One, because of some of the challenges that the kids had in getting to school in the community, and 2, because of the violence in the school, and 3, because of the drugs that were in the school. And they considered the school. We were at one of the high schools in the city of Detroit where we go in and we provide the training for them. And the kids said, this is what they saw. The bar in the community that these kids were in, the bar was considered a protective factor. And the reason is that during the day when they're getting set up and they're cleaning up and things like that, if the kids felt that they were in danger, they could run to the bar and be protected and escorted home. And the bar for them in that community was a protective factor. The gas station, I think it wasn't, it depends, it was both. They were risk and protective factor, but mostly the gas station were risk factors because that's where they sold vaping and cigarettes to the kids. And these places were around the schools. And we'll talk about what they did in their environmental scans later. The young people that you see here were presenting at CATCA, at our National Coalition Academies. I think this was mid-year that we took them and they presented. And they presented to over 180 individuals in that room. And the thing about it is that it was a 3-hour presentation. The kids were ready. I mean, we had to get them ready and we had to encourage them and we had to make sure. And they had all of these pictures were on a poster board around the room, and the group went and they labeled it either red or green, risk or protective factors. And in most cases, the schools were mostly green, the bars were mostly red, and the gas stations were half and half. And the kids then talked about every picture that was around the room from their perspective, from their community, from where they lived, that these were either risk or these were protective factors, and why. And so one of the things I think the lesson learned for all of us is that if you've seen one community, you've seen one community. They're going to be different. Those risk and protective factors are going to be different depending on that community and what the kids are experiencing, not what we see, but what our kids are experiencing. We also did a photo voice project, and we did it in partnership with the City of Detroit Health Department, where they came in, the behavioral health team came in and trained. We did an in-person visual training on the photo voice. It is absolutely amazing because, you know, back in the day, we'd have the 35mm camera and all the equipment and things like this. These kids went out there with their phones and snapped these pictures, and some of them were amazing. What they needed to then do, they did it as a group. They took all the pictures, they came in, and the kids then together wrote the story on what that particular screen would capture. If, as you know, 420, if you don't know, 420 is a marijuana dispensary, and their story here, one-way stop, the weed got blocked. For youth under 21, 420 will be stopped, because 420 kids could walk in without having to show ID and purchase marijuana. All right. And then, you know, amazingly enough, it wasn't until this past April that, or is it last April, that recreational marijuana was okay in Detroit. Medical marijuana has been here for some time, but recreational marijuana had not. Our question was, what does substance use look like in your communities? And the kids went out and they snapped these photos. This was one of their photo voices, was one of the pictures they snapped in their community. Cracked up beans and abandoned dreams, abandoned house, abandoned dreams, stolen opportunities and cracked up beans. Open windows and open doors. Those who left had open sores. This is what happened when you fail to resist. The bars are up and the urge still persists. Smoking weed to get high may not always make you die, but your hopes and your dreams will always be broken, cracked up beams. All right, and this is what it looked like to them. And we were, you know, obviously we were floored. This picture was taken on the main street right outside our offices. And that's why I say, I can't believe some of the equipment on these cell phones. This was the main street where the Forgotten Harvest truck was going by. They captured the one-way sign, the no-turn sign, and what was on the folks that were begging at the corner. It's addictive, I know, but please let it go. It hurts you, it shames you, and it drains you so slow. One way, no way. How can I make it out? I'm all but forgotten, even when I shout. And so these are things that are coming from our kids. The environmental scans. One of the things that happened with the advent of marijuana being authorized in the state of Michigan and in the city of Detroit, medical marijuana, et cetera. Our kids, we asked the kids, we took them out to do what were called environmental scans. We trained them in the office, and then they went out with staff and we drove around our communities. We have 3 zip codes in the city of Detroit that we target, 22 square miles, period, just 22 square miles that were there in the city. And in 2019, 18 out of 30 marijuana dispensaries that were open and operating in these 3 zip codes were not authorized to operate in our communities. And what they had to do was not only identify and take pictures of the outside of these marijuana dispensaries, they had to then go to the state's database to say which ones were authorized to operate in the city of Detroit. So then they met with our state representative, our city council person on the east side of Detroit, Scott Benson, who then and they did a presentation for him on what they found and what their concerns were. And their response to him was, what are you going to do about it? And he says, okay, let me give you to the person that may be able to do something about it. The kids went before city council and presented their findings. So then they had a meeting with Councilman Tate, who was sort of the leader of looking at the marijuana dispensaries opening up here in the state of Detroit. And they kept asking the question, what are you going to do about it? It took months for them to get a response. Even after they called, they would write, they would email, what are you going to do about it? And finally, one of the things that happened is that on one day, the inspectors were sent out and they went to these 18 marijuana dispensaries that were open and operating in our communities. And they had, if the dispensaries had to be open at the time that the investigators came. And of the 18, only one of them was open, King Seaweed. And as a result of what our kids did, King Seaweed was closed down. And so it was our persistent effort. It was going through the communities, and for our kids standing in front of city council and asking, what are you going to do about it? And that it resulted in King Seaweed being closed. And it's still closed, and it's abandoned, and it's yay. Okay, so, but part of the issue is there were still 17 more that, you know, that did not get touched. And so, of course, we will continue to do environmental scans based on the interest of the new kids that are coming in. The other thing that we did is that most of you do sign-on. And as you know, that the guidelines are now in the state of Michigan, you cannot sell vaping or cigarettes to kids that are under the age of 21, period, end of sentence. And we got a lot of calls from our principals around in the schools, all of the high schools, and saying, hey, we got this major issue with vaping. The other thing we do is called Hidden in Plain Sight. And the kids helped us put this together, and we did it. We set up our scene. It was like a bedroom scene for the chief of police, and he couldn't find all the places where we hid vapes and access to vaping stuff. He couldn't find them all. All right, which tells you as parents, we aren't going to find them all if kids want to vape and if they want to continue to use. And so one of the things that we found, our kids then went undercover. So we had some of the explorers that were 18 and 20, 17, 18, and 20. They went out with undercover police. They went out with officers, but they were undercover. They would go in the store, and it's a little bit different from how we did Sinar, because these were some of the neighborhood police officers that then could come back and ticket on the spot. So they went in, and it just sort of things that make you go, damn. All right, out of 20 gas stations located around our schools, 16 of them sold, even after asking for ID. And so, and the kids were stunned. We were all stunned. We just like, say it isn't so. But these were mostly gas stations. They were all gas stations, actually, and they were gas stations that were around our schools. And so the police went in and they issued a ticket on the spot to the person who sold, because they literally had to buy it, and then they took it back and it was evidence. And then the other thing is that we had partnered with the state, and so the state was there, and the store then was on hey, one of those, we got to go in and monitor twice a year. So the kids conducted a town hall, and we had the key community leaders, the city council, the chief of police, and a number of the parents and the gas station owners were invited, and a number of them did come. And the kids then asked the same question, what are you going to do about it? And the problem was that, they then broke into, we had them randomly go into groups and then come up with solutions with gas station owners, parents, police officers, the kids at the table, and then they reported out what their recommendations were. And some of the things we're going to be able to implement, training of store owners, looking at policies and guidelines around what it is that we could do if they continue to violate, the selling to kids under the age of 21. Looking at increasing the fines for around the schools. So these are all policies. And these are things when we talk about affecting the pond that we then are going to then, if we do that, if those things come to be, that what we're talking about now is how are we piece by piece cleaning up that pond. And so part of it is, this just happened in March. The town hall was in April, and now we're having a demand performance by one of our city council members to come and talk about this issue and to talk about what is it that they feel that they could do about it with the legislation that's already in place, and if not, to be able to introduce new. Our thing was, what is it we can do to train store owners? Because if you're going to be part of the community, then you got to make sure that you're part of making sure that our pond in this community is clean. The kids were recognized, youth leadership awards. They got all kind of recognition from city council. They got several awards from Youth United. And the big one that we were really excited about is that as a result of them shutting down King Seaweed in their community based on the work and their presentations that they did, they the Youth Connection, not the Youth Connection, but the Love Detroit Prevention Coalition, specifically based on the work that our youth did, was given the Chairman's Award, the 2019 Chairman's Award at CATCA. Again, national recognition for some of the work that we're doing. And so the other thing that we have to do is that once we are getting the kids, how do we keep them engaged? How do we make sure that our kids are going to do the things necessary to stay engaged and stay out of trouble? In those 7 strategies for community change, it also talks about engaging them in prevention activities, engaging them in that photo voice project, engaging them in all other kinds of things are a way in which we can keep our kids engaged. And so we have in the summer, they're part of our summer youth employment with the Michigan Department of Natural Resources. Kids who had never been on the water, they're going kayaking and they're going canoeing. We got them dressed up. They clean up pretty good. Oh my God, and their holy jeans are nothing. And they went to the NAACP as guests, as special guests. And, they do archery. The other thing is that they have to do community service. And one of the projects we have in partnership with the City of Detroit Water Department, the kids in our targeted zip codes are painting all of the fire hydrants. I did not know how many doggone fire hydrants there are in the city of Detroit, but just in our area, we're talking thousands of fire hydrants. And so they're going out and they're painting the fire hydrants. And I didn't know that there's special fire hydrants, and depending on what color they're painted, they may mean something else to the firemen that come to help put out a fire. We also participate quite often in the Red Ribbon Week, as many of us do, and we work with the kids that are there. And part of it, we get them out, we walk, and one of the things in Belle Isle we did, alcohol-free is the way to be, and our kids partnered in that. And so part of what we, again, not about me without me, if there's a project that we're working on, our kids are at the table helping us to say, yeah, that is something that we really want to do. They also help to plan it. They also, then they also respond. Because when we did the geofencing, and they were going into liquor stores and they get the social media or the prevention message around alcohol, they were calling back our media person, our communications guy, Jeff, saying, Mr. Jeff, I was just going in for a box of candy, and he got the prevention. So we know it was working. And so part of what we always want to do is to, one, be able to include the kids in the kinds of things that we're working on, and to make sure that, one, we do indeed hear their voice. And with that, that is my presentation. If anyone has any questions.
All right. Thank you so much. If you have questions for Dr. Dudley, she did include her information on her last slide. Maybe we can have that put in the chat. Just wonderful information. So we have come to the end of our wonderful day, our wonderful 10th annual Shoalition. We want to thank everyone for their participation. Just a few day-ending comments. First of all, I would like to recognize MCRUD's regional reps and partners. And so as those are brought up, for those of you that may not know a lot about MCRUD and would like to learn more, we encourage you to contact Mike Tobias, whose email you should have. I put mine in the chat, and Lauren Reed is our membership chair. Lauren, raise your hand so your photo will go to the beginning. She's our membership chair. And if you would put your information in the chat, that would be wonderful as well. We'd love to tell you more about MCRUD and have you be a part of us, especially at the regional rep and partner level. So there are the regional reps before you. Also, I'd like to again give my appreciation and thanks to the Shoalition Planning Work Group, Nicole Flickema, Lauren Reed, Kathy Geiger, Ellen Templeton, Tom O'Donohue, and Amnia Abdullah. Thank you so much for your work. We did it without a chair, right? So we didn't have a chair necessarily for the Shoalition, but it was definitely everyone's work and participation. And we'd like to ask for the planning committee to stay on an additional 10 minutes when we wrap up, if you're able to. And that's all I have. I'm going to give it away to Mike for any final comments. Thank you again, everyone.
Yeah, really, just want to echo some of what Lisa said, but really want to thank all the presenters. I think you did a fantastic job. Also want to thank the Prevention Network staff. Many of them are on the call now. Please complete the evaluation form. Let me stick that in the chat before you go. That'll help us to make it hopefully a better event. So let me hang on one second. Hopefully it'll go in there correctly. I think it will, but oftentimes I'm not very good at sharing these, but hopefully this evaluation will open up for you. But please just take a few minutes to complete that evaluation. Like Lisa said, we will get these certificates out hopefully in the next few weeks. I want to encourage you to participate. Again, contact Lauren Reed, membership chair, myself. If I know about maybe half of you, a lot of people I don't know. So we're looking to grow our MCRUD network. And so if you'd like to get more involved or learn more about MCRUD, please reach out to us. We'd love to talk with you about MCRUD. Hopefully we'll see you on May 17th, a special meeting to talk about the prom, graduation season, that sort of thing. And I'll send that out too as a follow-up to this event. But that's all I have. Thank you so much for participating. We hope to see you at another MCRUD event soon. And like Lisa said, if you're on the planning committee and can stay on for a few minutes, please do.
Bye.
Bye-bye.
See you next year.
Yes, we can.